Dear colleagues, I am Christoph Diener from the Department of Neurology at the University of Essen. Now, this is a report about interesting new stroke studies aimed at cardiologists. JAMA published a large meta-analysis of the use of statins to prevent cardiovascular diseases. The meta-analysis had more than 71,000 patients. And as you would expect, the meta-analysis convincingly showed that statins reduce not only the risk of myocardial infarction in people with coronary heart disease, but they also prevent ischemic stroke and they reduce cardiovascular death. Unfortunately, there was never a trial which compared two strategies. One would be to give a fixed dose of a statin compared with targeted doses in order to achieve a critical level of LDL cholesterol. I think in both fields, cardiology and stroke neurology, we now agree that at least in secondary prevention, every patient should receive a statin, irrespective of the LDL level. The second trial which was published was the so-called DIAS-4 trial. You all know that thrombolysis with TPA is established in a 4.5-hour time window. And the study group investigated desmoteplase, which is also a thrombolytic agent in a time window between 3 and 9 hours. And unfortunately, the trial was negative. It was based on imaging, so patients were very carefully selected, but the drug did not work in an extended time window. So I think for the foreseeable future, we have to stay with a time window of 4.5 hours for systemic thrombolysis. The third study came from the University of Heidelberg. You are all aware that thrombectomy is highly effective in patients who have occlusions of the distal internal carotid artery and the proximal middle cerebral artery. But there is a debate whether the treatment should be done in sedation or in general anesthesia. And the colleagues in Heidelberg did a randomized trial and they compared the two methods, sedation versus general anesthesia, and there was no difference in terms of outcome after thrombectomy. And the last trial is the so-called Ichtostand trial. This was a trial that was aimed to investigate hypothermia for the treatment of severe acute strokes. The trial was supposed to randomize 1,600 patients, but it was stopped when only 120 patients were enrolled. It turned out the treatment obviously is not effective. And if you need years to just enroll 120 patients instead of 1,600, I think it tells you this will never be a feasible treatment for severe acute strokes. I think the most effective treatment we have is thrombolysis and thrombectomy. So, dear colleagues, 4 new studies on stroke, which could be also interesting for cardiologists. I'm Christoph Diener from the University of Essen in Germany. Thank you for watching.